Get much reaction here? A little bit of reaction, so it's always sort of, it gets shared here in the hospital, and so there's generally some feedback and a little bit of interest. So there's always a bit of discussion, and it always sparks a good conversation about what kinds of things we're doing, the research that we're doing, and how it relates back to the work that we're doing here within the hospital as well.
And like I said, we can always tell the topics that sort of people become really fascinated with, and I think it has worked out with this one for sure. All right, I think we are all systems go on this Facebook Live, and we're also live on YouTube. My name is Christine Birak. I'm a health and science reporter with CBC National News, and today we are taking your questions on attention deficit hyperactivity disorder, ADHD. And here to answer your questions is a psychologist here at Sick Kids Hospital, Jennifer Crosby. Jennifer, thanks so much for taking the time to chat with us.
Absolutely, happy to join you.
So one of the reasons we're having this discussion is because last week I came to talk to Jennifer about some research out of the University of Central Florida, and it really looked at sort of a predicament a lot of parents and teachers find themselves in, parents and teachers of kids with ADHD. They'll say that, you know, on the one hand, when Johnny is playing video games or watching a movie, he has laser focus, completely fine. But if you switch over, ask him to do a math problem, watch this math video, do some homework, then all of a sudden he's all over the place. And researchers in Central Florida, they did their experiment, and they found, kids with ADHD, they can sit still. And the issue isn't that there's a lack of motivation or they're bored with the school work or the math instructional video. There's a cool video when you get a chance. We have a link to it on the CBC News Health page in the story, and you can see the difference when the young man is watching, I think it's a bit of Star Wars, and then there's like the math instructional video. So you see him moving around, and they say that is directly linked to their working memory. So it's not about the lack of motivation, it's not about boredom, it's about what's happening in their brain. And part of that fidgeting is, researchers in Central Florida were saying that's actually when they do their best cognitively. All right, so as mentioned, we are taking your questions on ADHD. Go down to the comments, put in your questions, and we will try to get as many of them answered by Jennifer here at Sick Kids. So to start us off, I want to ask you, and for those of you who are watching at home, what exactly is working memory? So we've been hearing that ADHD is not necessarily behavioral, it's not behavioral, that it's neurological. So explain to us what's going on.
Absolutely. So ADHD is a neurological condition. We sometimes call it a neurodevelopmental or neuropsychiatric condition. And we have known for a long time that individuals who have ADHD have a number of different sort of cognitive traits or weaknesses, and one of which is working memory. Working memory is part of a system called executive functions. There's a number of different kinds of cognitive processes that go into executive functions. And executive functions develop over time, and they're the skills that develop right through childhood, adolescence, into early adulthood. And sometimes the best analogy we use is sort of an executive assistant. So you can have a person with great ideas and wants to do great things, but you need to manage your time, you need to keep track of things, you need to figure out what's already been done. So that perfect little executive assistant who sort of stands behind them and helps them be organized, get on time, move them along. That system of executive control are really how we take our individual skills and pull them together and kind of apply them in a very organized and effective way. It includes things like working memory, response inhibition, organization and planning, even the speed with which we can get tasks done. It really helps with organization.
So let me ask you, and I see a question coming in, but before I get to it, what is the biggest misconception that you think that people have about ADHD?
So I think one of the biggest misconceptions is that individuals who have ADHD just aren't motivated or are not trying hard enough. And I think that that's really one of the things that I try to communicate to educators or parents or kids themselves who come and see me here, or my colleagues at the Hospital for Sick Children or other places, is that this is definitely not a deficit of motivation. In fact, I would say that individuals with ADHD are working harder than everybody else, because it really does take more effort and more work on their part to get the same amount of work done. It's just harder for them to remain focused, to not be distracted, to be organized, and to get the work done in an efficient and an effective way. So in fact, they're not actually working less, they're probably working harder than sort of your average individual.
Yeah, so a lot more going on than
Absolutely.
meets the eye. Absolutely. All right, so for those of you who might be scrolling by, stop and join us in this conversation. We're talking about ADHD. We're here at Sick Kids Hospital in Toronto, and we're talking to psychologist Jennifer Crosby. So put your questions in, and we'll put them to Jennifer. Okay, we see some coming across. The first one is a comment from RJ Wayfarer. I want to apologize in advance if I get some of the names wrong, and I will, but I will do my very best. They have video games in seniors' homes, and it improves memory functioning. So does it work the same for kids with ADHD?
That's an excellent question, and it's an area that we here at Sick Kids are in fact doing quite a lot of research on. So a big part of the research that I do here in collaborations with others and with a commercial partner that we have here from Ontario called eHave, we've created a video game to try and train working memory. So the work that we've done here, but other groups right around the world have tried to tackle this issue is if in fact these executive functions are related to a lot of the behaviors and the deficits we see in ADHD and in fact some other conditions as well. If you train them, can you actually see an improvement in behavior? And there's been some nice work that's been done elsewhere, but we are actually trying to build on that and not just train a single executive function, working memory. The video game we've created is going to train working memory as well as response inhibition. And we're actually going to add on some other executive function processes as well. So the hope is that by training these tasks, you can have improve these executive functions and ultimately have an impact on behavior overall. Now this is a clinical trial we're doing here at Sick Kids. We haven't started it yet, so we don't actually have clear answers. There's been some evidence by other groups that you can improve the working memory. What we haven't quite figured out is the degree to which it has a positive impact on the overall behavior of the children, and I think we still have a bit of work to do to really kind of understand that. But it's definitely the same kind of idea of what you see in some of these cognitive games that are available. What I would say is a number of the ones that are available commercially right now may not quite have all the science behind them. And so what we're trying to do here is really get some clear answers so that we can provide kind of clear answers about what we actually think is effective, how much, what you need to do. Yeah,
great comment, RJ, because that seems the direction that this is headed. So this is sort of the forefront of what they're trying to work on is how do you develop that working memory and can you? Okay, Lucy Bartlett is asking, what kind of fidgets have been shown to help with attention?
Well, that's a great question too.
And I feel like somebody is spinning a fidget spinner. So asking, is this helping?
I suspect somebody is spinning a fidget spinner. It's a really great question and one that comes up quite often with families. And you know, one of the things that often I do and others who I work with, who work broadly within this domain, is to provide recommendations for family as to what will be helpful. And for some individuals, being able to move around can be very helpful. Although I will say the use of fidget toys, not necessarily fidget spinners, I would say sort of more traditional fidget toys are ones that allow a bit of release of motor movement. I sort of squeeze my hand because the sort of traditional one was something like a stress ball or a squeeze ball. And teachers forever have actually come up with mechanisms to help kids in the classroom. Sometimes you can get little wiggle seats that you can wiggle on. Sometimes they'll put bands around the bottom of a chair. You can hook your leg behind it. And the objective there is to allow individuals who really feel the need to fidget in a way that doesn't distract them from what they're doing. So something that's helpful in the classroom for individuals who need to fidget is something that lets off a bit of that motor energy, doesn't distract them from getting their work done, and definitely doesn't distract the individuals around them. And for some individuals, this can be really helpful, but I will say that for some other individuals who also have ADHD, it can be quite distracting. So it's the kind of recommendation that when I provide it to families, I really tell them, you know what, you have to kind of try this out. You have to communicate with your school. You have to think about where your child is at and what kind of learning environment they're in to figure out what's going to be helpful for them. So it's definitely not a one-size-fits-all. And while it can be quite helpful for some kids, depending on what they're using, for other kids, they just don't seem to work. And the same applies for sort of young adults, adolescents. even individuals into adulthood who have ADHD. What can be helpful for one can actually be a little bit distracting and get in the way of getting work done.
Yeah, so you have to figure out what works.
You have to figure out what works, and it does tend to kind of change over time. And if you're alone in your room doing something that's kind of annoying but actually helps you get your work done, that's fine. But you can't do that same thing in a classroom if it's going to distract the person next to you. You know, if you're clicking a pen, it's going to maybe make the person next to you crazy. If you're clicking a pen in your own private office and it's helping you get work done, that's no problem. So you sort of have to think about the bigger context as to what's going to be helpful for you, but also kind of work within wherever it is you're trying to get that work done.
I think that's interesting because in researching this story, we had also talked to a researcher in Florida, and he had talked about how we all fidget, actually. As soon as I sit down in a meeting, I'll start doodling and doing stuff. We all do it. Kids with ADHD fidget twice, if not 3 times as much as the average person. But in some ways, it's to keep their brain alert too, which is the reason that most of us fidget to begin with.
Right. And it can. One of the interesting things about ADHD that's worth commenting here, since we're talking about fidgeting, is that actually not all individuals who have ADHD fidget. In fact, a fairly significant proportion of individuals who have ADHD have the inattentive type. And those individuals can be completely fidget free, and it can make it a little bit difficult sometimes to identify those individuals because they're really busy people who are fidgeting and moving around. Sometimes can come to the attention of parents and teachers a little bit faster.
Right.
But so it's just worth mentioning that not all individuals who have ADHD manifest as fidgeting behaviors. But sort of back to your question about what they look like in the classroom, that it's for some people that fidgeting comes out from working, having their system kind of loaded up, that there's a lot going on and they're trying to pay attention to one thing, but there's other things going on around them that draws their attention, or this sort of overflow of motor activity that can kind of get in the way. And for some individuals, if they're fidgeting, if they're doing something, it can actually help them stay on task. But again, it depends on how they're moving around and what they're fidgeting with that can sort of dictate whether or not it's helpful.
Okay, great question, Lucy. All right, I got to get moving here. Christopher Brown is asking, what's the best way to tell if a child is truly suffering from ADHD or if they're faking things just to get attention from a parent?
Right. Well, I would always say that the best way to actually get that sorted out is to connect with professionals. There's a range of professionals that can help families do a thorough assessment. Family doctors are a good start point. There's psychologists, psychiatrists. There's a range of individuals who are trained professionals who are capable of doing a thorough assessment. And in the context of those assessments, like the ones that we do here, but other places all over the city, they really do take quite a detailed history to figure out whether or not these are traits or symptoms that have been present for a long time and that are really causing difficulties across a number of situations. It's not just sort of one situation or one time. It's really a pattern of behavior that persists over a long period of time that there's evidence of from a fairly young age. And you see it across multiple situations. So it's not just at school or just at home. Really, in most cases, you can see these traits causing some impairment right across the board. So home, school, sometimes in recreational activities, sometimes with friends. So what we're looking for when we are thinking about whether or not somebody meets diagnostic criteria for ADHD as a disorder, we're really looking at the traits that are present or the symptoms, how long, what situations, and really what's most important is, are they causing impairment for that individual? Are they getting in the way of important things in that individual's life? Those are the kinds of things that go into determining whether or not we think they meet full criteria for ADHD. So I would recommend a full assessment by a qualified professional who can help unpack whether or not it's a label or a diagnosis that fits for that individual.
Yeah, I think that's a question that a lot of parents have, Chris, so thanks for asking it. Okay, next question comes from Eve Simard, is asking, can ADHD be overcome with age?
Well, that's a good question as well, and one that I get asked a lot by families. And what we know from the research is that over time, the presentation of ADHD can change a little bit. Sometimes those hyperactive impulsive traits get a little bit less over time. And there is a small subset of individuals who seem to grow up and really don't seem to have any of the traits anymore that go along with ADHD. And if they had an assessment at that point in time, the opinion would be that they no longer have it. That accounts for a smallish percentage of individuals. For a larger group of individuals, A subset does in fact persist right into adulthood. They still have enough symptoms and enough impairment that they would still meet criteria for ADHD. But there's another group sort of in the middle who, as they go into adulthood, tend to have maybe not the full criterion of symptoms, but enough symptoms that are causing enough impairment that they do in fact still kind of fall within that broader range of having ADHD. There used to be an idea that individuals grew out of this, and I think that that came from the fact that these hyperactive impulsive traits tend to go away, but what we now know is that really the inattentive traits and that restlessness just becomes a little bit more internal. They can sit at a chair and they can, they're not getting up from the table, but they still struggle with being on task and being efficient in the things that they do.
Well, they're not standing out in a classroom anymore.
Well, that's it.
I think,
right?
And I thought that was actually very interesting. Why we tend to really speak about it with regards to kids is there's conformity in a classroom. So when somebody is outside of the realm of what's happening, it's easy. But once you get into a work setting, people are. And
I think that's the other important thing, in that for helping people understand that we really do see this as a lifelong disorder, and it can vary slightly as many traits happen, and what you're trying to do, sort of the stressors, the environment that you're in can have a big impact. So there's points in your life when you need to pay really close attention, and there's a lot of things that you need to get done very efficiently, and there's other points in your life when that's less of a criteria for you. And I think individuals who struggle with ADHD, when they're in those environments where they're really required to have very keen attention, these traits can kind of become impairing for them.
Right. All right, great question. Really good questions here. Heather Clothier is asking, how can a child be tested for ADHD? How do you reach out for help on handling a high energy child?
Right. So it kind of goes back to an earlier question where I said I think the best people to consult with regards to whether or not you need an ADHD assessment, or whether or not even that's something you should consider for your particular child, is to start with your health professional kind of team. So start with your family doctor. You can talk with them. Sometimes you can talk to teachers as well. Your teacher in school environments or daycare workers have a really good kind of litmus test or feeling for what's developmentally appropriate for kids. Because at different ages, there are behaviors and levels of hyperactivity that are quite developmentally appropriate. Younger kids are really busy, and that's just the way younger kids are. So sometimes the question is my child busier than other individuals?
Right.
And is that busyness getting in the way for them? That tends to be the key question. But ultimately, whether or not it's busyness that you're concerned about, or whether it's attention and concentration, what you want to do is start with your family doctor, see what they think, raise your concerns, maybe speak with other individuals who know about child development, and from there you can figure out the next step. So lots of family doctors, pediatricians, developmental pediatricians feel very comfortable in doing an assessment with a family, and then other times they feel like they want sort of a more thorough assessment that could be done through psychologists or psychiatrists sort of here at the hospital, but in sort of a range of settings across the city that can comment on that. Within school boards, there's some capacity to do assessments that can comment on whether or not attention and concentration seem to be a factor in that individual's learning.
All right. Heather, I hope that answers your question. Family doctor is a good place to start.
Good start point.
Patty Jackson is asking, to medicate or not?
Well, I'm a psychologist, not a psychiatrist, although I do work in this field. And what we do know about the treatments of ADHD, and this is based on many, many decades of research, is that there's two main treatments for ADHD. One of them is medication, and we know a lot about medications, and they can be very effective for quite a large percentage of individuals with ADHD if their families and the individuals choose to go that route. So we know that it can be very effective. The other main treatment are behavioral interventions. So that's really how you modify the environment in which an individual exists. So that can be sort of how parents interact with a child at home, or child, youth, an adult at home, and the same within the school environment. And that's sort of how we can change how we teach or interact with that individual to really kind of help them be their best self. Usually what we recommend is a combination of both, but I will say that there is good evidence to show that both of these lines of intervention can be very very effective. And when we do assessments, we make sure the families sort of are aware of both options for them to think about and talk about with their care team. Again, you want to always talk to your prescribing physician about it.
Family involvement can be empowering as well, because you do get a certain amount of education about what's going on, and explanations sort of to look at things differently in a way. And there was a study that actually came out recently that said that some of that training can be done online and be just as effective as a parent meeting with someone and receiving that training on how to better handle situations with their ADHD child, which could open up that realm of training for a lot of parents. If you don't have time to sit down and kind of do that, to get that training online would be really helpful. Okay, lots of questions coming in here. For those of you who might be scrolling by, come join us. We're on Facebook Live and on YouTube. We're taking your questions on ADHD, and we're here at Sick Kids Hospital in Toronto, and we're talking to psychologist Jennifer Crosby. She sees a lot of patients and she can answer a lot of your questions, so put them down in the comments and we will try to get them answered. All right, next question comes from Michael J. McNeil asking, do you test for dyslexia first? Are there similarities between dyslexia and ADHD? What a great question.
That is an excellent question. So we do know that there is quite a lot of individuals who have both ADHD and learning disabilities. The term we use is comorbidity. So we do know that quite often learning disabilities and ADHD can be comorbid. But his question is excellent because it is important to understand an individual's learning profile. There are definitely children who have learning disabilities such as dyslexia or reading disabilities. And if they're really struggling within the classroom, they can look inattentive. So it's important to factor that in to thinking about whether or not an individual may have a learning disability or some sort of learning difference that might be making them look a little bit inattentive in the classroom. So whether or not really focusing on the learning itself may kind of solve that attentional problem, or whether they do in fact have both of these conditions, which we definitely see lots of families here who legitimately have a ADHD as well as a learning disability. And it's important to know about both because you want to actually be kind of tackling both of these concerns to treat them and teach them in a way that you can really optimize their learning. So if you just focus on the learning and don't have some strategies in place for the attention and concentration, sometimes what you're doing on the learning won't be as effective, and vice versa. So it's a really excellent question, and it's an important thing to consider. And for professionals who work in this domain, we're sort of always thinking about that. You might be thinking about the ADHD, but you want to be looking at the whole person. You want to be looking at their full developmental history. You want to be thinking of other factors in their lives that might be part of their presentation. So we look at things like learning, we look at anxiety, we look at language development, we look at life stressors. You want to look at the whole picture to figure out what's going on, because ultimately that's going to come up with the best treatment recommendations for that individual. So the ADHD piece might be one part, but really there may be other things that that might be really useful for that family and that individual, and the ADHD is just one piece of it in a bigger kind of, people are wonderful and complex, so you want to make sure
there's a big picture that needs
you don't want to
approached.
boil it down to one sort of answer. You want to look at the big picture, and learning disabilities such as dyslexia are definitely something that's forefront, because the overlap between those disorders is we know is quite high.
All right, Michael, thank you for that question. That was great. Okay, Yvonne, I think it's Yvonne Cardinal is saying, I myself am ADHD. I find learning to finish a project or sentences difficult. As I'm getting older, I find that I'm also distracted quite easily. Is that it? And so you had mentioned that in a lot of cases we do tend to associate ADHD with children, but most people carry it through. Are the strategies that somebody who's older in approaching ADHD any different from the strategies that are sort of given to younger?
Right. So I think the main difference about strategies that are going to be implemented in an adult is how it's done. So younger children have much more interactions with parents and teachers. So the person in charge of adapting that environment is probably somebody else, not the child.
Somebody else, yeah.
And so as you can imagine, as you get through into adolescence, we try to get the adolescents to be more involved, become a bit more independent, and trying to figure out what strategies they themselves can implement. And in adulthood, it's really kind of having the individual themselves figure out what strategies are useful. I will say that technology in many ways can be very helpful for individuals who have attention problems, and we talk about working memory and some of these cognitive traits that go along with it. And there's some, you can use things like reminders and notes, and it used to be people had sticky notes, and some people still like sticky notes, but coming up with ways in which you can help yourself be organized, stay on task, and it's really more about the individual figuring out what works for them.
Yeah, and the researchers that I spoke with in Central Florida who had done the study, when I had asked Mark Rapport at the end, so what's your advice? And he said, organization, organization, organization. Yeah. He said the more organized you can be, the easier things will, the things will get.
Yeah, absolutely. And we say that right across the spectrum of ages, but yeah, organization's important, structure's important, having sort of lots of good feedback, reminders, ways in which you can, those external cues can be very helpful in getting people back on track and staying on task.
All right, Yvonne, thank you for that. Now we have a viewer on YouTube commenting, my child is 8 years old and he keeps forgetting tasks, responsibility. He talks a lot in class, but he's very receptive. He takes a lot of time to do things because he gets distracted easily. Does he have ADHD? Well, and we have gone over this territory, but I think this is a question a lot of parents sit at home wondering, they're watching behavior and you don't know, but you hear a lot. And my understanding is that ADHD is roughly 5% of the population, and yet I've got to say in doing this story, I feel like every person I talk to seems to know somebody, oh, my son has ADHD, oh, my husband has ADHD, oh, my...
Well, it's interesting because, 5% ballpark, and then, it can go up a little bit as well depending on the population. And what that means is in any classroom there's one or two kids who have it, and with that prevalence, it means that you do actually know somebody who has ADHD, whether or not you know it or not. And I think it is quite common. And with regards to specific questions about kids, as I said, if you're concerned, I would raise the question with teachers or people who know your child very well. You can talk to your family doctor. You can keep an eye on things. There's ways in which you can start to kind of figure out whether or not this is getting in the way or not, and whether or not you should go for a more thorough assessment.
And I think that's an important point that you've made a couple of times, is that how is it getting in the way? What sort of issues is it causing?
Right.
All right. Next question comes from Vicky Rowan, and she asks, if your child does not respond well to medications, what else can you do? And I think you had brought up some of the strategies.
So there's some behavioral and environmental strategies you can use within the school and within the classroom and at home as well. And we're trying to identify more non-pharmacological interventions that we think will be effective. So as I said earlier on, I mentioned that we're going to be doing a randomized control trial of an intervention that we think will be effective in building up skills and executive functions, specifically working memory and response inhibition. And the objective is to hopefully have a positive impact on ADHD traits longer term. A lasting effect. And that's really the key question. So we know from the literature that you can have some impact in the short term, specifically on those executive functions. What we're still trying to figure out is how to have a longer term effect. So when you're not playing in the video game, can you keep those executive function benefits that you've kind of worked on while doing the intervention, and keep it long term, and will it have an impact on behavior down the line? And we are optimistic and hoping that our trial here with our video game called Mega Team will do that, but we're just about to start. And what's interesting is it's not just with ADHD. We're actually looking to see if those kinds of strategies can be helpful in ADHD, but in other disorders that we also know have executive function deficits, such as autism, and we're doing some work with individuals with congenital heart disease as well.
So I think the answer is, Vicky, yes, there are other things that you can do. And I think, as Jennifer mentioned, a great place to start is with your family doctor and start to look at strategies. Okay, next question comes from Charm Ion, asking, how much does sleep or lack of sleep impact ADHD in kids? And are there specific sleep strategies for kids with ADHD that are poor sleepers? So this is something that's come up in the news recently as well.
Absolutely. And sleep is really important. It's really important for everyone. And it's been in the news a lot about kids, but I think adults as well. They're really showing that that sleep is important,
Yeah.
and
We're
it has
just
an
not
impact.
restfully sleeping.
Yeah, and I think that sleep has an impact on wakefulness and attention regardless, and so I think it's definitely a factor for individuals who have difficulty with attention and concentration. And so we do always talk with families about making sure the kids are getting enough sleep, and many of the kids who we see struggle with sleep, and it's not just kids with ADHD. This is a pretty common concern with parents of children and adolescents of all ages. So the strategies that we would recommend are not specific to ADHD necessarily, and there are some great resources about how you can help kids with sleep. I know there's some on our website at Sick Kids, but there's ways in which you can try to really optimize sleep routines for kids, and usually it comes down to setting up routines, what we call sleep hygiene, like what do you do around bedtime, what time does that bedtime start, how do you kind of keep kids in their own space so that the whole family's not awake. There's a range of strategies that you can use to optimize sleep. I would say there's none that are specific to ADHD, but it is important in general, and if you don't get any sleep, as everyone will say, whatever your sort of personal ails are, they're always worse when you're exhausted.
When it comes to kids and sleep, there are just no easy. They're all exhausting answers.
They are. So, and I would say with sleep, you just want to
strategies.
stick to it. I mean, if you have a strategy that works well, there's always reasons why, we couldn't do it this time. Kids get sick, or adults get sick, or travel, or what have you. But I would say come up with a strategy and stay the course, and just try to get, go back to what works, to get as much sleep as possible. And it's always good to remind yourself, how much sleep should my child at this age get? And there's always a range. Some kids need more sleep, some need less, but you sort of want to be in that ballpark of the recommendations about how much sleep kids should get.
And don't stress too much, because stress is bad for sleep.
You want to come up with strategies that you can do that will work and be effective without making yourself too crazy.
Yeah, absolutely. For those of you who might be just scrolling by, this is a CBC News Facebook Live, and we're also live on YouTube, and we're taking your questions on ADHD, and psychologist Jennifer Crosby is here to take as many of your questions as we can get in. So let's keep moving along. Doug Kerr has a comment. My son loves his fidget spinners and fidget cubes, but he can't use them in class. We find a bouncy cushion, though, helps a bit.
Yeah, absolutely. So that's a really good example of something that's been used in classrooms for a long time, because it allows that motor release, but in a way that doesn't distract other individuals around that person. The tricky thing with some of the fidget spinners or the cubes is that they do actually, in fact, distract the individual who's using them. You kind of want to look at them, or other people want to look at them. And the other thing I would say is that they don't let off too much of a motor release. The fidget, kind of what we call wiggle seats, or the fidget seats, or the I think he called it a wiggle pillow. I'm not sure what he called it there. Those can be great because kids can kind of bounce in their seat. They get some of that kind of motor feedback, and it can serve the same purpose without distracting individuals around them. So yeah, it's sort of coming up with a strategy in a classroom that fits for that environment. And you really do need to consult sometimes with teachers in a classroom to figure out what's a good fit for that class. Yeah.
And I mean, I think that, like you said, once you engage this, talk to your family doctor, talk to teachers, and within school boards as well, they often have processes by which some of these supports can be added. So these are conversations that need to be had, and it's a process, and it's going to have its bumps along the road as well. But
I mean, with that too, I mean, one of the recommendations that you often hear for kids who, whether they have learning problems or what have you, is to put them right at the front of the class. And I will say that can be really helpful, but sometimes for the kids who need to get up a little bit, having them a little to the side of the class can be a way in which they can stand up next to their desk and maybe work while standing up a bit, but while not distracting other kids in their classroom. It's sort of an example of how you need to be a bit flexible about what kinds of strategies you use in a classroom. Because if you're right in the front of the class in the middle, if you're standing up, that's going to maybe be distracting to other students. But if your desk happens to be kind of well located near the front of the class, but maybe to the side a little bit, not all the way over, but maybe just on the outer edge, it means that if you need to get up and kind of stand up, and if that's going to help you kind of let off some of this motor this motor excess, and that's not disrupted to the class, it can be helpful. But it kind of helps to work with the teacher or wherever it is that you're learning to figure out if that's possible. And it's not going to be appropriate in all situations, of course. Not all classes, not all times, but sort of being a bit flexible in your thinking about what can be effective.
Yeah, thinking about that room to move and where it should be.
Yeah, absolutely. Yeah. What's going to work for that individual and in the environment that they're in.
Okay, great point, Doug. Thank you for that. Okay, Roxanne Murphy asks, what test do you use to diagnose whether someone has ADHD? So I know you talked about it's a process. Is there a specific test?
So there's not one specific test. It's really based on a kind of a detailed clinical interview. So the diagnosis comes out of a range of symptoms, and clinicians will meet with families, they'll meet with the child themselves, they'll review the history, they'll sometimes get information from teachers either directly or from report cards. And they use all of this information to determine whether or not an individual actually meets criteria for those symptoms and whether or not they're impairing across situations. So there's no one test that allows. It's more sort of a detailed clinical assessment that looks across these different symptoms to see whether they're present, but then also to figure out how long they've been present and in what situations they're present and how much impairment they are causing. So as I said, it's useful to kind of connect with somebody who knows a lot about them and knows a lot about child development, because what you're looking for is whether or not these traits actually are present more than you would expect based on that developmental level. As I said, really young individuals are pretty busy all the time, and that's normal, that's totally fine. What you're looking at is whether or not these symptoms are there and whether or not they're getting in the way.
Right. Okay, great question, Roxanne. And Yves Simard is asking, are video games a good outlet for ADHD, or are they simply aggravating the condition? I think this is a great question. I think a lot of parents have issues with video games to begin with.
So, I mean, I think that the standard video games that kids play are recreation. So I think my answer to that is everything in moderation. I think that, you know, how much screen time kids have should be offset by how much time they do other things as well. Not all video games are the same, so you know.
Not all created equal.
Yeah, exactly. Yeah. So for any child, determining what screen content's appropriate for them based on their level is important for parents. You know, there's some more educational stuff, there's less educational stuff, but ultimately it's just a new form of recreation. And so I think parents just have to make good decisions about how much time individuals spend doing recreation. And so is it getting in the way of academics or in family life or socializing, and then it becomes an issue. So I think my answer to that is not specific to ADHD. We don't have evidence that it's making the situation worse. But I would say that for any child and parent, you sort of need to negotiate what's an appropriate amount of time and what's the appropriate type of video game to be playing. As I said, in our case, we're trying to develop a video game that's going to be helpful. But I'm assuming she's not asking about that. I think she's asking about
video games in
all
general.
the ones that kids
the bane
that
of
kids
my
like to
household.
play. Yes. Yeah.
All right. Thanks so much for that, Eve. All right. This question comes from Kyle McLean, and he's asking, as a teacher, how can I help my ADHD students do their best in exam situations?
Right.
What a great question, Kyle.
That is a great question, and that's one of the areas that we speak a lot with families. So one of the things we know about individuals with ADHD, and I kind of started off with this, talking about how I think they actually are working harder, in fact, than some of their peers, is that in exams and tests, one of the things that can trip up ADHD individuals is that often it takes them longer to get work done. And so one of the things that can be really useful for individuals with ADHD can be extra time on tests and assignments. The other thing that in general, whether it's on a test or not, that teachers can do is really providing a lot of those external cues. So repeating instructions, touching base with that individual when they go back to the desks, check in, you know, oh, do you know what you need to do to get started? Maybe coming back a few minutes later, oh great, you've got this step done, can you move on to the next one? Because those deficits in organization and planning often undermine productivity. It's not that they can't do the work, it's that they lose track of what they're supposed to do next. And if someone could just help them stay on track.
I actually thought you gave a great, when we spoke about the research paper, you gave the house of cards.
Right.
I thought that really drove it home for me. So you talked about it as a cognitive house of cards.
Yeah. So parents will often say, you know, we talk about working memory and or any of these sort of executive functions, but working memory being a good example. So with working memory, it requires taking on some information, holding it, and usually manipulating and doing something with it. Sort of what we call it updating. So a good example is, you know, go upstairs, brush your teeth, get your bag, tell your brother it's time to go. So you need to keep track of all that. You need to monitor that you've done one, you got to move on to the next one. You might run into your brother on the way. There's sort of a lot of things to keep track of. And so what often people will say is that I understand that they can't hold 3 or 4 things, but why can't they keep one? Like, why can't one of the things get done? And sometimes the system just gets a bit overloaded. And I'll often hear from descriptions from parents or even from adolescents themselves, that they'll sit in class and they'll listen to like a lecture, and the teacher will give them an instruction to go back to their desk. It'll be something like, if you're finished your math, take out your English, do number 3, and when you're done that, do your project. And what happens is the individuals go back to their desk and they actually sit down and they're like, they actually remember none of it, because it is a bit of a house of cards. They sort of, once you hit a certain level, you can get a bit kind of overloaded and somebody needs to kind of re-prompt you. And if the teacher just pops by and says, okay, do you have your math done? And they'll be like, yes. They sometimes can then kind of remember what needs to happen next. But the system can get a bit overloaded, and so it's good for teachers or parents to be like, okay, I'm going to start with this one instruction, let's start there and move on. Not to say you can't give them more information, but you do need to come back and help remind them where they're at to keep them going. Otherwise, they can just get stuck. And it looks a bit like they're getting nothing done, but they just need someone to kind of prompt them to move on. And then they can do the work and get it done.
Yeah, organization.
Organization, yeah. And prompts. It's this idea that those external prompts are very helpful for individuals with ADHD. So the reminders, this is what's coming up next, this is what we're going to do, this is what this is what you've gotten done. That can be very helpful to kind of move them along and keep them on track.
Kyle, thanks so much for that question. I think that's great advice for parents too. And it can be hard for teachers in a classroom because you have all these other kids, so to circle back with one. But there's strategies that, trying to keep them organized and stay by these kids a bit more if you can, if that's possible within a classroom, is just great advice. All right, we are, I think we're running short on time now, so we're going to try and get in a couple of more questions here. Caitlin Louise Chatterton says, I have ADD or ADHD and I find music helps me a lot. Is there any scientific evidence that supports this?
So I'm not personally aware of explicit evidence to show that music helps. I think that for some individuals, sort of having something that isn't distracting to them can be helpful, that they can get more done. And I think that, people range a little bit in how they respond to that. Some people can work really well in a busy coffee shop and other people need it to be completely quiet. So I don't know of any explicit information about with it for ADHD, but I do think that a certain degree of kind of something else that's going on that's not too distracting can be helpful for some individuals.
So, I mean, it seems like in a lot of ways this range, there's no one answer for
everybody.
For everybody.
There's not.
But I think it's great when people find things that work for them, you know, and it's whether it's the organization and I think, as you mentioned, go through those resources to try to find, talk to your family doctor, talk to your children's teachers, talk to the daycare. Once you're working on it, you're bound to end up on a track.
And people who work with kids have lots of great strategies. So what works in a classroom one year, it's good to tell the teacher. It's good to be flexible because that environment might be different. But knowing what works for you as an individual, we really empower adolescents to start to kind of take some ownership for that. Like, what is my learning style and what is helpful for me? What do I need to do my best work? Because ultimately, as they go into the workforce or university or whatever it is they're going to do, even just being independent adults, sort of knowing your strengths and knowing what's weaker for you can really optimize sort of how things go. And I focus a lot on the strengths too. So for kids with ADHD or all kids, it's really important for parents and teachers to know, what are they really good at? Because ultimately that can be a really important tool in helping them in the areas that are harder for them. So if they're really good at science, if they're really kind of good at visual spatial things, really try to utilize that because we like to do the things that we're good at, and we can really kind of dig in on that, and it can be a very effective tool to sort of motivating us to get through the stuff that's a bit challenging for us.
I think that's actually a great point where we'll end the discussion, is that finding what you're good at is important for anyone, and I think you feel empowered when you find what you're good at. And I think in a lot of cases, from my research, for kids with ADHD, it can be a struggle in that process, and it can be a bit demoralizing at times, and feeling like you're up against challenges. So figuring out what you're good at and feeling empowered is actually, and people learn differently.
They really do, and helping other people know what kids are good at too. So when children go into another environment and they're working with other adults or teachers or what have you, if you know what your child's good at, tell them that. Say, you want to know what, they might have some difficulty with attention, and so they're going to need some extra reminders, but they're really excellent at helping. They have great social skills. They're really great at teaching things or working with younger kids. Whatever it is that they're passionate about, make sure you communicate that to to the people who are working with them, because then they don't have to discover it on their own. They can really use that as a tool, and it helps your child know that you're aware of this, that yeah, you know what, there's some areas that you need to work on, but there's also areas that you're really great at, and having those kids know that the adults in their world are aware of that can be quite powerful.
Jennifer, thank you.
You're very welcome.
And thank all of you for all your great questions. It was a fascinating discussion. I think the CBC Facebook Live is now officially over. Thanks for tuning in, and on YouTube as well. And we'll see you guys next time. See, the questions were great.
They were.
I thought that actually some of the ones, I think people do circle back on how can you tell.
Yeah,
because,
absolutely.
You know, even in researching this, I have moments where I'm like, this is one of my kids.
Yeah.
This is my,
If you read through the list, they